And Delhi and North India's air emergency is worsening as we speak. A thick layer of smog lingers over Delhi and its adjoining areas right through the morning and indeed the afternoon as well. Pollution levels slipping into the severe category yet again. The air quality index in the morning stood at 408 as farm fires spike in neighbouring states and vehicular emissions go up. The contribution of farm fires to Delhi's air currently is close to 38%. Now, the government has made several requests to the people of Delhi, the AAP government in Delhi, saying report construction activities, report fires, carpool while going to work, and so 5 requests being made. But having said that, and work from home as well to reduce vehicles on the roads to try and bring down vehicular emissions at this point. But the images that you see on the right of your screen, not because of fog or because it's the onset of winter, but really because of the smoky conditions pervading across the National Capital Region. Fine particle pollution, PM 2.5 levels. Now, PM 2.5 is the really dangerous, significant particulate matter. And now that's at 80 to 100 times what is safe currently. And Delhi is being forced to breathe this toxic air as a political blame game also plays out between the Aam Aadmi Party, which rules the state of Delhi, and the BJP, which is in power at the centre. Now, already some talk about schools shifting to online models yet again. And remember, this is should be a last resort given all the disruptions we've seen during the COVID pandemic. At least one private school has already said it will be conducting online classes starting tomorrow, and more schools could follow suit. So here is why the rising levels of pollution are considered such a medical hazard. My colleague Vedant reports from inside a pulmonology department, and which is seeing a spike in the number of patients coming in with respiratory trouble.
Well, Delhi's now annual air quality crisis has kicked in. The AQI has worsened to the severe category, and the lethal PM 2.5 pollutant is at levels between 400 to 500, which is almost 80 to 100 times the WHO safe limit. Well, I'm here in a pulmonology OPD where, in fact, I'm joined by a patient who's complaining of chest pain and wheezing. And so, tell us your name first.
I'm Atul Jain. I live in Green Park, Delhi.
Right. So what are you experiencing? What have been, your experience in the past 15 days? And, tell us about why you've come to see a pulmonologist.
Well, immediately after Diwali, in fact, the very next day, I felt this choking in the throat, and then I contracted fever as well as sore throat. So I'd taken a medicine, but after 4 days of medication, now I've developed another kind of cough and a lot of wheezing in my chest, and it's total chest congestion. I'm feeling that as if pollution is choking me that way.
And so now, of course, you've come to a pulmonologist. I'm sure you've been, going from pulmonologist to pulmonologist. But now, what do you think is the solution for it? Because the air quality is continuing to worsen here in Delhi.
I think immediately after taking the medicine today, I want to leave the city. Okay. I would be out of Delhi for at least 4 or 5 days till I'm fine.
Right.
So I think that is the only solution. Medicine, of course, is. But what can medicine do if the pollution is the same?
Right. So, of course, this is the gravity and the severity of Delhi's air pollution, with people telling us that they are willing to leave the city until they are fit again. Well, I'm joined by lead pulmonologist, Dr. Vivek Nangia. So, these kind of cases, I'm sure, are coming now, especially after Diwali, and now that, the AQI has worsened. So, what are the kind of particular symptoms that you're seeing, and what is the age group in which you're seeing these symptoms?
So this is a classical example of Mr. Jain's case is classical example of what we've been experiencing in the last few days. Most people who are coming to us are coming with complaints of cough, cold, congestion, soreness in the throat, like a foreign body, something stuck inside the throat, and a lot of congestion in the chest, a lot of wheezing. And please note, he's never had wheezing in the past. He's not a known asthmatic. So this is the first time he's had a problem like this, and I'm having to add nebulizers for his treatment, and also steroids, because that's the only way I feel he'll recover. Otherwise, if this goes on worsening and doesn't come under control, we may even have to hospitalize him and give him oxygen and all.
Right, so that is the severity of the problem. In fact, we are here at a pulmonology OPD where, many such cases, in fact, have been, coming up. In fact, I'm joined by another, patient here who's come to see a pulmonologist. So tell us about your experience. What have you been witnessing? Your mother-in-law is, unwell, and why have you come to see a pulmonologist?
So the air quality in Delhi is only deteriorating, and this year has been, I think, a little bit worse. I think also coming out of COVID, everyone's immunities are destroyed. And this air quality of 480 AQI this morning, I mean, this is just unacceptable. We have elderly, like my in-laws, my mom-in-law, my parents as well. Even the little children, under the age of 7, where their lungs are still developing. It's really, really sad to see them because they leave for school so early in the morning, and it's just like a blanket of smoke where you can literally smell the smoke. Right. So it's just recurrent cough, wheezing. You know that their airways are constricted. You can feel that they're not sleeping very well. It's just a really, really bad situation.
Right. Ma'am, would you like to in one line tell us what your experience has been? I mean, especially for elderly, it's been really bad.
Yeah. After COVID, we have all survived, but this is again something else. I feel now we really need to have proper this thing. We should be taken care of.
You're feeling chest pain, wheezing. What is it?
Yeah. Wheezing and chest pain, and that cold and cough is not going. It's so uncomfortable. The whole day you're taking medicines and steroids. It's not right.
Right.
I mean, government should really do something about it.
Right. So as we've been reporting, it's children and the elderly who are at the worst hit and are the worst affected as far as health risks of air pollution are concerned. In New Delhi with camera person Sanjay Kaushik, Vedant for NDTV.
It's really a question that's going through all our minds at the moment. How do we restrict our exposure to this killer air? What is it that we can do? Joining us on the program, Vivek Chattopadhyay, Senior Program Manager of Centre for Science and Environment, CSE. We're also being joined by Dr. Neeti Talwar, Additional Director of Pediatric Pulmonology at the Fortis Memorial Research Institute in Gurugram. Dr. Talwar, let me begin with you because this is such a pressing question for most parents at this point. Exposing their children, especially younger children and babies, to this kind of air. It's not just what can happen to them in the short term, but what the long-term health consequences of exposure to such high pollution levels can be. What is your advice to them? Is it better just to leave the city, even for a short duration? Because I know so many people who are contemplating doing just that.
Okay, so good afternoon, everybody. What my advice would be that, for everybody as a general rule, it would not be fair to tell everybody to leave the cities and go outside because you never know what the AQI levels are over there. Because the cause of the pollution and all these particulate matter of more than 2.5, more than 10 is because of farm fires. So the rural areas as well as the urban areas are equally badly affected. So what my advice would be to stay indoors. Okay, so avoid the peak traffic hours. That would be probably 8 to 10 and in the morning, and possibly 4 to 8 in the evening hours. So please ask your children to remain indoors and restrict their outdoor play activities and change it to indoor group activities so that they don't miss out on the fun. The second thing is about the school, the most important question about the school. So we could either, when the AQI levels are crossing 350 plus, I think it would be better to have online classes because anyways, children are used to it and there is a set system in which we could conduct their classes and the studies don't suffer. Whenever they are going out of the house and they are going to the schools, they should be wearing a well-fitted N95 plus mask.
Yes.
And, all the rules of hygiene have to be followed. Another important point that I would like to say is about indoor pollution. We are all talking about outdoor pollution. So indoor pollution is something, the pollutants, the chemicals that we are having in the we are having at home, and because of the closed windows and the doors, those pollutants are going to cause more of a problem.
So then do
to
you
the
suggest indoor purifiers wherever possible? Or
whenever easily possible, yes, filters would help. I'm not advocating them because we cannot restrict the child to one room or to one, circumferential area. They would be running around and it would have a lot of financial burden. So I wouldn't be advocating it because, the ones with HEPA filters are the ones which are going to be helpful, which come at a premium expense. So even the air conditioners, if you could just switch on your air conditioners, even that as a filter, that would also help. So adequate ventilation of the house and seeing to it that you're using chemicals to a minimum level. Your scented candles and your, your chula and barbecues, all that has to be at a minimum level. All fragrances, even the ones which are used to mop the floors, even those scented fragrances have to be brought down to a minimum.
Okay, those are very important tips and easier tips to follow, I would imagine, Dr. Talwar, than trying to sort of have these very big investments in air purifiers. But it's interesting that you do recommend that schools at least shift online for now. And Vivek Chattopadhyay, there are clearly sort of two views on this. We've seen so many disruptions to education already during the years of the pandemic. I think it's the last thing parents or teachers would want to sort of see at this point. But really, is this now the only way out? And where does the buck stop?
See, what I would like to say
Dr. Talwar, if I could just bring in my other guest on this, I'll come back to you, of course, for your thoughts on this as well.
Yeah.
Certainly, it's a very difficult time because we are out of COVID period. Now the schools have opened and the kids are going back to the school, but air quality is so poor, particularly during the morning hours and night time.
Yes.
So during morning hours, even the people are advised not to go for walking and jogging. So kids are exposed while going to the school, but there is no other solution because even if you allow, say, leaves, the kids will play outside.
Right.
So there is no way people can be protected in such kind of air quality. So certainly we have to be very concerned about this issue, and we cannot pass the buck on one issue to another or one state government to another government, because it has reached to such a situation that...
As someone who's been dealing closely with this year after year, does it frustrate you that for a while, for the month of November, sometimes into December, the middle of December, this is going to be on the headlines of every news channel, the biggest headline in newspapers, doctors will be raising alarms, and for a while this is going to dominate conversation. But the moment the air quality improves, and that could actually just be sort of weather conditions improving, that will actually blow some of the particulate matter away, and then, that blows the discussion off the table as well. What do we need to do to ensure that this is something that is tackled not just in these months when it becomes unbearable, but right through the year?
The major thing that the government has to do, that we know broadly, several studies have been done in Delhi and NCR and other places. We know the sources of emissions and the pollution. We have to act very tough since the beginning of the year. And if we wait till winter, suddenly we cannot make a major change. Here, what we can do, like we can stop some activities and they can be little benefit on breathing space.
Right.
But the drastic reduction in pollution will definitely come from like sustaining our action. For example, we have improved the vehicle fleet by introducing Bharat Stage 6 emission standards. But still the power plants are polluting. So like we have to go by source to reduce the pollution. Parali burning or the stubble burning is a major issue that happens.
Which has just now really become a political battle between states and the center as well. But Dr. Talwar, at this point, really sort of having measures in place to get through the next few weeks really seems to be the need of the hour, because people, we heard so many people at a pulmonology department at the Max Hospital also talking to our reporter, saying they're feeling kind of burning sensations in the eyes. They feel that they're choking all the time. People who've had no previous history of asthma saying that they're now having to take steroids, which again, of course, brings its own set of problems with it. So, what really can we do apart from limiting exposure? And you're saying indoor pollution is also a feature. So that is obviously something that most people don't seem to factor in.
In addition to indoor pollution, I would also like to point out the car hygiene and the car pollution. We are not really taking care of our car hygiene, and we are using those, those perfumes and not realizing that they are triggers. The child will get an exposure, you won't realize it, and for the next 7 days to several weeks, the child would be unwell. So taking care of these two things definitely. And another thing which predisposes children is because of their short stature. So all these particulate matters ultimately are going to settle down, and at their height they are going to have many-fold more exposure. So coming to the basic point that we have to take drastic steps in a very well-planned manner, in which the government as well as the people have to join hands rather than passing the buck, as Dr. Saab said, and blaming on each other. So we have to join hands, do whatever we can at our individual level, and forcing the government to act quickly and act effectively, rather than just creating headlines. So, like I said, staying indoors and trying to stay indoors, and we are forgetting the pregnant ladies, because exposure in these vulnerable women are going to expose our fetuses and our newborns, which will become a huge problem on their mental function as well. So there is a lot at stake, and I think it's high time. Every year we can't just go on giving points and then like you've pointed, just it will all just go under the table and then wake up next year and
Dr. Talwar, senior citizens as well. We've talked about babies and expecting mothers, but senior citizens also who already perhaps have a tendency to respiratory trouble.
Yeah. So I would advise everybody to take the precautions which infections, your flu shots, your pneumonia vaccines, they all have to be taken by the children so that their carrier state goes down and they don't pass on the infections to the senior citizens at home, grandparents and their mothers.
Right.
So that is one thing you can do. Yeah. And eating healthy and exercising. Being indoors doesn't mean that they have to just be in one corner and with a book and on the TV.
But what about, there seems to be so much contradictory advice when it comes to exercise. And, there is obviously this worry that, when you exercise, then there is a greater risk of sort of breathing in more of this very toxic air. So what really is the final word on that?
Yeah, so we could go by, everybody's reading the newspaper, it's all over the internet. You go by the AQI levels of that particular day and the PM 2.5 levels of that day. Usually it is 1/3, less than half to around 1/3 of your total AQI. So your 2.5 particulate matters are going to just slip in right into your tiniest of airways and go into the alveoli, and then they're going to enter the bloodstream, and then they're going to have their effects upon your heart, upon the brain, upon all the other organs. So go by the AQI, and let's not be very rigid. I mean, in case they are in the tolerable levels, we could open the schools and let the children go, let them be what they are. In case they are going above 350 plus, then it's better to not take a chance. Everything has a risk-benefit ratio. So can we really risk their lungs and their future and have a lot of allergies? The West is full of allergies. So, everything, of course, is not related to pollution. There is a lot of seasonal changes, the pollen, and a lot of things with genetics, which comes into, making a child asthmatic. But whatever we can avoid, we should definitely do. Otherwise, you're going to have a very unhealthy adults down the line.
All right. Thank you both very much indeed. And of course, we're going to keep talking about this and really the health effects rising out of this kind of killer air and what we can do to sort of minimize it at the local level also. Thanks both of you for joining us. We'll take a quick break. More coming.